Bleeding internal hemorrhoids. Hemorrhoids are caused due to overexerting oneself during a bowel movement. They are swollen areas of skin and blood vessels around the anus. They develop around the external opening of the anus and are highly innervated and sensitive and are also at risk for thrombosis. They develop around the external opening of the anus. Internal hemorrhoids occur above the pectinate or dentate line in the anal canal. They are covered by a mucous membrane. The internal hemorrhoid is graded to assist with the selection of a treatment plan. The treatment is then provided according to the grade. The grade of the hemorrhoid depends on the extent of descent into the anal canal and out of the anus. The most common sign of internal hemorrhoids is rectal bleeding. Hemorrhoids can ooze fresh red blood, whether located externally or internally, but bleeding internal hemorrhoids may produce fresh blood in the stool. Reasons for bleeding internal hemorrhoids. Hemorrhoids can develop from any common sources of pressure, including constipation and extra straining of the bowel, diarrhea where the expulsion of loose stools is continuous, sitting or standing for prolonged hours, obesity, lifting very heavy weights or objects, and pregnancy and childbirth. How to deal with bleeding internal hemorrhoids. Consult a doctor immediately. If you have been suffering from bleeding internal hemorrhoids, then inform him if your bleeding is not stopping. If you are not aware of why you are bleeding, then go back for a checkup, as more often anal fissure is mistaken for bleeding internal hemorrhoids. Wipe yourself with clean, wet toilet paper. Wetting the paper makes it softer. Ask for emergency care if you notice large amounts of rectal bleeding along with dizziness or faintness. Treatments for bleeding internal hemorrhoids. If the bleeding is not stopping with prescribed medicines, the doctor may recommend rubber band ligation. Here, 1 or 2 tiny rubber bands around the base of an internal hemorrhoid to cut off its circulation and the hemorrhoid falls off. Cellular therapy. In this process, a chemical solution is injected around the blood vessel to shrink the hemorrhoid. Laser treatment. A burst of infrared light can cut off the circulation to small, bleeding internal hemorrhoids. Hemorrhoidectomy. This is the last recourse if all other procedures fail. Here the surgery is done with either local anesthetic combined with sedation and requires an overnight hospital stay. For more information, click the link below.